So, what happens while we're waiting on the transplant list for the surgery to actually take place? Well, every 6 weeks you have an appointment at the liver transplant clinic where they take your blood pressure, do a weigh-in, see how much weight you've gained, any fluid increase. You then speak to the consultant and the coordinators to discuss general health since your last appointment, discuss any medications being taken and any questions you may have yourself or your family members who will be there supporting you when you, after the op sort of thing, at home and things. So I'm currently on blood pressure tablets, which prevents bleeding from the main blood vessels in the abdomen because the blood vessels are slightly distended, so it just stops any coughing up blood or anything that going wrong. Because as soon as you start coughing up blood, then that's serious medical emergency. I'm also on water retention tablets to help reduce the water retention. My kidneys are also tested every 6 weeks to make sure, or every 2 weeks, depends how the consultant wants, to see how well my kidneys are functioning and if they're struggling at all, so they can review that water retention medication. I was also advised to take vitamin D3 and K2 supplements to help with the immune system, because at this time you're very rarely at the house and you're always in darkness. Plus, the D3 is a very important vitamin for general health, basically, and keep your immune system hunky-dory, and helps prevent other illnesses as well. After you've seen the consultant, you then go and see the nurse, who is usually there to take 5 or 6 vials of blood, where you will get all the blood tests taken that the consultants need for your next meeting, or to see how things are progressing since your last appointment. What they've also started is where you speak to physio, where they've started proactive events where, or they've got a fancy name for it, but it's basically being proactive to make sure they check your health, your balance, your strength, and any workout programs they can give you to help keep you fit and healthy as possible whilst you wait on the surgery. It stops it being just reactive, so after the surgery you get all the physio help, but if you can get you as fit as possible before your surgery, then that's all the better still. So that's essentially what happens while you're waiting on the list. You go to the hospital once every 6 weeks, or however often they decide they need to see you. It could be a phone call where they come and see us, or it could just be an appointment sent to you. So that's what happens. Thank you very much.